use the oral frailty concepts. This is the oral frailty diagrams. This oral frailty diagram is real complex. Later explained what is oral frailty. Next content is what is oral frailty. This is a definition of oral frailty, but it's so difficult, so I skipped. Oral frailty diagram is consists of 4 phases. First phase called decline of oral health literacy. Okay, and next is oral frailty, and the next oral function. This phase covers Medicare system. Previous time I show you the and the final phase is oral function disorders. First phase is start with social frailty, and social frailty leads to the oral literacy reduction. Finally, leads to increased risk of tooth loss. For example, the periodontal disease and dental caries risk increasing. And next, oral frailty phase. Oral frailty phase starts with a decrease in articulation or slight choking and increasing of unchewable foods, and finally leads to the reduction in the food diversity. And next is oral function phase. Oral function phase starts with the reduced occlusive force and reduction in the tongue movement and articulation, the biting force, and etc. And finally leads to the sarcopenia and the nutrition, malnutrition. And finally, a phase is oral function disorders. This phase starts with some disease, for example, the stroke, dementia, etc., and multiple drugs start with this phase. Start with the eating swallowing disorder, and next multiplication disorder, and finally leads to the nursing care needs. These are our frailty diagrams, but maybe this program, this diagram is really complex. So I'll show you the simplified model of oral frailty. Many elderly people think feeling difficult chewing at first. This is not a good image, but this image and this thought leads to easy to choose the soft foods. It's a bad habit. This bad habit leads to the decreasing the chewing ability, and this leads to the feeling difficulty chewing. And next is this. This is a negative cycle. At first, this negative cycle moves slowly, but some bad accident occurs. This cycle will rapidly increasing. For example, the stroke and dementia and some bad events. And finally, negative cycle leads to the loss of the appetite. Okay, this is the same simple model of oral frailty. But most important point is the most important strategy is to recognize the slight deterioration of the oral function at the earliest stage. Okay, this is the most important point. So I'll show you the these previous slide, I showed you the oral variety concepts. It consists of the 4 phases. Every phase is some social system covered in Japan. First phase, the ground oral health literacy, covered population approach, and next oral variety phase covered community health programs, and third is the duration of the oral function covered general dentist since 2 years ago in Japan. This system introduced in the first floor, and this phase covered specialty medical doctor or dentist. This is already a covered Medicare system in Japan. Maybe the same station in the Korea. So today I talk about this phase for about oral hub function. Oral hub function is always said the new Japanese medical system since April 2018. And this is the management flow for oral hub function. At first, assess and diagnose oral hub function. Today, I've shown you this phase. Next, making oral function management plan. Next, making informed consent for the patient. Next, the motivation for the patient and life advice and nutrition guidance. And reassessment every 6 months. This flow is Japanese Medicare system. Okay. This is the diagnostic criteria of oral hub function. Oral hub function assessed by having 3 or more of the following the 7 factors. Always show you the 7 factors. First, oral hygiene status, oral dryness, occlusal force, tongue lip motor function is pa 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 ka 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 ta ta, and tongue pressure, and musculatory function, and finally for swallowing function. Alright then, and please make the image 7 assessment. 7 assessment consists of 3 groups. Poor oral hygiene and oral dryness, it means assessment of oral environment. Okay, environment. And occlusal force and tongue lip motor function and tongue pressure, it means assessment of individual oral function, every oral function. Okay. 個々の口腔機能を見てますってわかるかな。まずここは口の、最後までいくわ。And 6th and 7th means musculatory function and swallowing function is assessment of total oral function. Can you imagine? これは口の中の環境を見てます。でここは、口の中の一つ一つの機能を見てます。例えば噛む、あとは唇ベロっていうような動き、でここはこういったものを総合的に使う機能をチェックしています。こっちの方がわかるかな。じゃあ、大変？大丈夫？じゃあ